This is the Emergency Medical Minute.
All right, so good evening, everybody. So I was going to do a little cardiology topic here. So, every so often we see patients who have a wide complex tachycardia, and, if they're stable, then it presents a little kind of treatment conundrum. So when we talk about wide complex tachycardia, specifically, rate greater than 120 and, QRS wider than 120 milliseconds, so wide QRS, we have to figure out what this could be. And what are the couple things that we think about with a wide complex tachycardia? A couple rhythms. First dangerous thing, VTAC, and then less dangerous, things like SVT with aberrancy, sometimes just bundle branch block with sinus tachycardia where you can't see P waves really well are the two big things. So the big thing is it stable VTAC or is it SVT with aberrancy? And it can be very hard to differentiate. And we're not going to talk about how you differentiate those. We're going to talk about treatment, assuming it is VTAC. And the best thing to do is assume that it's VTAC, treat it as VTAC. So what are some of the options for treating that we have if we think somebody has stable VTAC? So they're awake, they're talking to you, they're not having chest pain, they've got a normal blood pressure, but they're going fast and it's wide. So what are the couple options? So Amiodarone. What are some other medications? So dilt's a possibility. We can talk about that in a second. So some of the other options, people have talked about treating these with adenosine first because, if it's an SVT with aberrancy, it can get better. Sometimes it treats VTAC. Some of the other medications are Procainamide, which is actually kind of the first recommendation for medications. Lidocaine is kind of a classic one we used to use. Some people use magnesium. And if we don't want to use medications, then what's our other option? So cardioversion. So the recommendations now are actually, first, just synchronized cardioversion. It's safer. It treats everything we have talked about besides sinus tachycardia, but it treats VTAC, SVT with aberrancy, and it's very safe. If for some reason, if the patient doesn't want to be sedated, they have a aversion to being shocked, then the first recommendation for medication is Procainamide. After that, potentially Amiodarone. The problem with things like diltiazem or other calcium channel blockers is that it can make certain rhythms a lot worse. If you have WPW or another underlying weird thing, then calcium channel blockers can make it worse. So anyway, in summary, wide complex tachycardia, assume it's VTAC. Don't try and overthink it and say maybe it's SVT. And then first choice would be electricity. Then Procainamide would be the best choices for medications. Any questions? Thanks, guys.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.